Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth Beyond the Treadmill. What can a nuclear stress test tell us? And trust me, it's juicier than your cousin's peach cobbler. You know what? You've been told exercise is heart healthy your whole life, and that's absolutely true. But here's the kicker that'll blow your mind. What if your daily treadmill workout is actually hiding a dangerous heart problem? What if that runner's high is giving you false confidence about your ticker? Today we're going to reveal what nuclear stress tests can detect that your regular Saturday morning jog simply cannot. So buckle up, because this might save your life. Let me tell you something that's going to sound crazy at first. Those feel-good endorphins you get from exercise, they're fantastic, but they're also master magicians when it comes to masking underlying heart issues. Your body is incredibly smart and sneaky. During your regular workouts, it compensates like a seasoned actor covering for a co-star who forgot their lines. Those blocked arteries? Your heart finds workarounds. It opens up tiny backup roads like GPS rerouting you around traffic. You feel fine, maybe even great, but underneath the hood there's trouble brewing. Nuclear stress tests are completely different animals. They're like having a heart detective with X-ray vision watching your ticker under controlled scientific conditions. We're not relying on how you feel or whether you can finish that 5K. We're looking at the cold, hard truth of what's happening inside your chest when we push your heart to work harder. But here's what most people don't realize, and this is where it gets really interesting. Nuclear imaging shows us blood flow to your heart muscle in real time during stress. Think of it like watching traffic patterns on a highway from a helicopter. We can see exactly where the traffic jams are, even the ones that haven't caused major backups yet. This test can detect blockages as small as 70% that won't show symptoms during your normal daily activities. Yep, entirely true, I can't make this stuff up. We're talking about preventing heart attacks by identifying problems before they become the kind of emergency that lands you in my operating room at 2 a.m. Let me share a real example that'll make this crystal clear. I had a 52-year-old marathon runner come through my clinic. This guy was a machine. He was training for his 10th marathon, felt fantastic during his runs, had energy for days. His annual physical showed normal EKG, perfect blood pressure, cholesterol numbers that would make a 25-year-old jealous. By every measure we typically use, this guy was the poster child for heart health. But something nagged at me about his family history, so I ordered a nuclear stress test. Good thing I'm stubborn. That test revealed an 80% blockage in his main artery. 80%. This man needed an immediate stent. Without that test, my friends, he would have had a massive heart attack within months, probably during one of those training runs he felt so good about. This is exactly what I explain in Beyond the Treadmill. What can a nuclear stress test tell us? These tests are absolute game changers in cardiology. They're completely non-invasive, take about 3 hours from start to finish, and provide us with detailed mapping of your heart that's more precise than anything we could do even 10 years ago. If you're over 50 or have any family history of heart disease, this test should be on your radar like a hawk watching a field mouse. The procedure itself is straightforward. We give you a tiny amount of radioactive tracer, about the same radiation exposure you'd get from a cross-country flight. Then we stress your heart, either with exercise or medication, and take pictures while your heart is working hard. Then we take more pictures when you're resting. Comparing these images tells us everything we need to know about how blood flows to every part of your heart muscle. Here's your actionable takeaway, and I want you to write this down. If you're over 45 or have heart disease risk factors, diabetes, high blood pressure, family history, or if you're that person who says, I feel fine but hasn't had comprehensive heart testing, you need to have a conversation with your doctor about nuclear stress testing. Maybe I should see you in the clinic. We need to talk. Don't let your regular exercise routine give you false confidence about your heart health. Your morning runs are fantastic, but they're not a diagnostic tool. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.